Hey everyone, welcome to another episode of Scrubs in Software. So one of my first episodes, I guess 2 weeks ago now, was with regards to a tool similar to this. So this is going to be about Vera Health. And in one of the comments, someone had said that they use that. I actually connected with one of their founders and team members as well, and they kind of shared more about this. And so I thought it was cool enough definitely to create an episode and kind of point out some of the differences that this tool has compared to that other one that I had talked about. So this is Vera Health. The cool thing, the thing that first stood out to me is that it is personalized to your specialty. And so they actually, it seemed like, have a focus on emergency medicine. They have a bunch of emergency medicine physicians on their advisory board. They have kind of tailored that towards that demographic. Now, obviously, it works for likely any specialty. It's still using the vast evidence and data that exists in a bunch of medical literature and publicly available databases like JAMA and whatnot, but they really do want to make it more usable by emergency medicine physicians. And why is that important, right? I may be working in a freestanding emergency department or a rural ER, and giving it context is important. So me saying, hey, I'm in a solo coverage freestanding, I have this scenario, what should I do? And it being able to kind of personalize that more towards that situation versus just giving you, maybe a textbook answer that would be valid at like a level 1 academic trauma medical center type situation is really useful. So it is free to sign up for at the moment. It does ask you for your NPI, and then I didn't put I was an emergency medicine physician or anything, but based on the NPI, I think it identifies that, and so it can already tell, like here it says what other emergency physicians are asking kind of down here. The other thing that I kind of saw that was really upfront is that you can get CME, so just like when we use UpToDate, and you can potentially get CME there, same thing here, which is nice, and you can kind of redeem it, and there's all the kind of nitty-gritty information about accreditation and everything as well, which is nice. The looks like the content library, when you click on it, it says content library coming soon, so it'll be interesting to see what they put there. You can look at your history of searches, and then of course kind of the main area where you would be asking it questions. So it's let's just kind of play through this. It's saying what other emergency physicians are asking, and so it looks like they are asking a whole bunch of stuff. This one's interesting. So a 28-year-old female, G1P0, 32 weeks, new onset hypertension, headache, right upper quadrant plane, elevated LFTs. So maybe like HELP syndrome or something along those lines. I like that it does show you kind of the work that it's doing, where it's querying things. And I think that's helpful from a medical perspective, because in healthcare, we're very skeptical of technological tools, right? We want to know where that information is coming from. And with AI, there's this whole kind of black box idea, right? Where there's this black box and you really don't know what's happening. I think even just seeing this, kind of having an idea of like what it's doing, where it's searching stuff, kind of gives you that reassurance that, hey, I kind of have an insight to it. So most likely diagnoses, I said HELP syndrome, here's preeclampsia with severe features, acute fatty liver pregnancy, and then most important not to miss diagnosis, and then it's listing a few different things there. And then once again, let's see what references it gives us. So like the other tool I had reviewed, it is giving me different references, and you can click on them. That's pretty cool. Show 14 more references, and that's the other cool thing. It is giving you kind of a vast amount of sources it's pulling from, and that's helpful because obviously you don't want it to be all based on one thing. I also like that it's giving the date and the number of citations, and so that's obviously giving me an idea, right? So if the bunch of stuff that it's quoting is from like 1999, that's probably not going to be medically up to date. I'm probably going to rely on it less versus something that obviously I'm seeing 2014, 2004, 2022, 2022. And then you're also seeing like how many citations they have, which is kind of nice. Just knowing that, hey, this is something that was heavily cited and used versus 0 citations, maybe you trust it less. Let's see, so treatment plan, when you click on that, a bunch of people are asking various treatment plans for things. That's cool. The thing I liked when I was playing around with it was the clinical calculator. So like MD Calc, we all love that. We all use that. This kind of almost has that built into it. So what I clicked on was the CHADS-VASc score for AFib in a 65-year-old with hypertension and diabetes. Once again, it's showing me all the work. But what you'll see here in a moment is it kind of creates this nice little calculator for you. And then you can kind of click through it and it'll change the scores and then tell you what these scores mean based on what number you gave it. So this is probably my personal favorite feature, where you're almost like in real time building this and then calculating a score, and then it's giving you what that means. So I wonder, let's see, what other calculators does it have? Wells for PE, MELD. Let's see if it has an NIH. So there you go. What is your current level of pain on a scale of 1 to 10? So that's not really accurate. So let me give it a little more context and maybe that will help. I have a stroke patient. So I just put I have a stroke patient in the ER and want to calculate an NIH score. And it'd be interesting if it lets me do that, and if it does, yeah, so perfect. So this looks accurate. So I'm just gonna add a few, just give this person a score of like 8. So does it give me what I would need to do with an 8? So yeah, it's telling me a score range, moderate, consider IV TPA, possible thrombectomy. So once again, I love that with these scores, it does give you a calculation, and then you don't have to go far to kind of get that treatment pathway or things that you should be considering. Once again, obviously, we're not relying on this to like make a diagnosis or anything like that. What I think it would be useful for is those kind of fringe cases. Like I can imagine this being where a patient has like a certain allergy to an antibiotic, and maybe they don't have insurance, so they need some generic version of an antibiotic, and I have some urine sensitivities from a while back, and then using all of that information to see, hey, what would be like the best antibiotic choice for that patient in a place where maybe I don't have access to pharmacy, I'm solo coverage, and that's like a lot of mental hoops to jump through, where maybe it gives me a recommendation and then I double check that recommendation, and I, potentially if I'm at a large center could call the pharmacist, but maybe I don't have that available. I do love the look of it. It feels very kind of agile, clean, not clunky. Other things I'm seeing here, prior auth, so that's interesting. So let's click on, obviously in the ER I would not use this, but prior auth for Entresto, failed lisinopril, EF 25%, NYHA class 3, and let's see, I imagine it's going to generate a letter for me that I could then just send off. Yeah, that's pretty impressive. So it's literally putting everything in there. I can only imagine how useful this would be for like a primary care doctor's office that is obviously bombarded with a lot of patients, a lot of kind of work like this that needs to be done that is usually short-staffed, and this could be a game changer for that scenario. So yeah, stuff like this, it still shocks me that stuff like this is free, it's accessible. And if you're in one of these offices, you can use these. And then patient instructions. I know one of the comments in that last post that I made, one of the doctors, I think it was Dr. Dayton, had mentioned that he used it frequently for instructions. So let's click on patient education for newly diagnosed type 2 diabetes, which actually happens quite a bit in the ER. And yeah, I love this. Now, obviously, we're going to have, if you have Epic or whatever EMR, they all have their own and hospital-approved ones. But once again, in some settings, you may not have a fancy EMR. You may not have fancy discharge instructions. You may be working at a solo rural place that barely has a functioning EMR. These things are going to be really, really useful. The other thing I'm seeing is even while I'm just clicking around, it's showing my CME credits kind of increasing to for now. So it's kind of nice. This is something I might actually kind of keep an eye on and see if I can submit them, and what my hospital and other kind of entities will say, and if they'll accept them. But yeah, I thought this one, this tool was cool enough where it was unique, more individualized. I love the calculator functions as well. And I definitely thought it was worth making a video about. So if you're watching this, and once again, you have another tool you think is cool for me to check out, or that needs some light shed on by a frontline clinician, please send it over my way. Thanks for watching.